This video will show a step-by-step procedure for performing an intermittent bolus enteral tube feeding. Prior to the procedure, please be sure to complete the following steps.
I have gathered the equipment that I will need. It includes an irrigation tray with a 60 ml piston syringe, the supplemental feeding that is ordered per the physician, and a towel. I want to place the towel over the patient and pull the NG out from under the pillow. I'm using the towel in order to protect the patient, the bed, and myself from any drainage or secretions. First procedure that I need to do is to check for a proper placement of the tube. I need to clamp the tubing in my hand so that when I release the plug, I will not get any secretions coming out of the tube. I'll take my piston syringe, insert on the end of the NG tube, release my clamping, and I will pull back until I see gastric secretions coming through my tube. That way I am assuring that I am still in the proper place in the stomach. I will then proceed to continue aspirating in order to check the residual volume of the stomach. In order to maintain the proper fluid and electrolyte balance for the patient, as long as I do not have over 500 mLs of residual, I need to give this back to the patient in order, again, to maintain that fluid and electrolyte balance. Because I had 40 mLs on this patient, which is way under the 500 limit, I'm going to slowly push on my plunger in order to give the patient back the residual contents of the stomach. I will then need to clamp my tube again, release my piston syringe. I will have placed water into my graduate container, warm tap water. I will proceed to fill with 30 mLs, release my clamping, and I need to slowly inject the 30 mLs of water. I need to do this in order to clear the tube of the secretions that I just obtained. Clamping again. I will once again release the syringe. I will take the plunger out and replace the syringe itself. Unclamping as I begin to pour in my supplemental feeding. I want this to go into the patient by gravity, and I want it to go at a slow rate. By doing so, I need to make sure I do not hold the tube and the syringe any higher than 18 inches above the level of the tube. I will proceed to continue adding more fluid to my syringe until the prescribed amount has been given. I want to prevent any air from getting into the base and into the tube. I will then clamp my tubing, obtain another 30 mLs, and I will proceed to flush the tube with the 30 mLs. When I am finished, I will clamp again, and I will replace my white plug. I do need to keep this patient's head of bed elevated for at least 1 to 2 hours after the feeding. Some of the highlights to remember are to flush with 30 mLs of water before and after administering anything down the NG tube. That includes medication, supplemental feedings, and possible water flushes ordered by the physician. I want to monitor the weight on a daily basis, use strict I&O procedures, and perform blood glucose testing as ordered by the physician.
Following the procedure, please be sure to complete the following steps.